Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. My name is Siti Haniza binti Muhammad Noor from Faculty Management and Economics, University Pendidikan Sultan Idris. My supervisor name is Dr. Nurul Fadli bin Habibin. So today I'm going to present my research proposal, which is my research title is a study of privacy and data security in artificial intelligence adoptions, enable services for the healthcare industry in Malaysia. We move to our introduction part. What is AI and its adoption in healthcare? AI is a human brain functions. Then the phrase is used when robots can do tasks that formerly required human intelligence. According to McKinsey and PwC, its research, implementation, and use are all advancing quickly and contributing to the global economy. AI is rapidly taking over the healthcare system, transforming it from a manual to an automatic system in which humans do regular tasks in medical practice to the management of patients and medical resources. What is connection between AI and data protections? The facts confirm that AI and health data in themselves represent a data protection challenge, so the combination doesn't make it any simpler. Why need to study data protection in AI? The data privacy and security issues surrounding the use of AI have been a topic of growing interest among diverse communities, especially in healthcare sectors. So, according to Nabila 2020, Malaysia is the fifth worst country for personal data protection. The problem statement of this study is, according to Sunarti et al. 2021, found that facilitating early acceptance, long-term implementation in the health system, and a lack of respect for the user's perspective are among the obstacles of the AI technology adoption. The advance of AI has triggered several unresolved issues, such as the liability of the software and robots, privacy and security, and new data privacy problems have arisen with the use of this technology. However, leading to concerns about the balance between innovation and privacy and the needs for better data protection method that can evolve along with big data and AI. And finally, lack of awareness of safeguarding data protection highlighted inefficiency in day-to-day processes and in data collection of citizens' information. Now we move to our research objective, questions, and hypotheses. The research objective for this study is to study the effectiveness of current strategy implementation to protect data in AI technology adoptions for the healthcare industry in Malaysia, and to study the effectiveness of current privacy and data security practices in AI technology adoptions. While the research questions of this study are, how is data protected under the current strategy implementation for AI technology adoption in the healthcare industry? And how does privacy and data security being upheld in AI adoption? The hypothesis proposed for this study, hypothesis 1, there is a significant relationship between data protections to use AI. Hypothesis 2, there is a significant relationship between the data privacy to use AI, and hypothesis 3, there is a significant relationship between data security to use AI. Here the summary of the literature review. According to Stilgoe 2018, AI allows to continuously learn from and solve new problems within an ever-changing environment based on its continuing collection of data. While Thomas and Ravi, AI rapidly dominates the health service system as well, and AI is a study to emulate human intelligence into computer technology. McKinsey Analytics argues that data quality, governance, and security are all important considerations. Data issue will always be at the forefront of pushing AI technology successfully. While Linen et al. 2021 summarized, the GDPR includes various principles and rights, such as data users' accountability and openness, right of access to personal data, the right to be forgotten, and the right to be informed about the data obtained and stored. Karim et al. 2017, to prevent breaches of sensitive information and other types of security incidents, a proactive preventive approach and measures must be taken by every healthcare organizations with attention to future security and privacy needs. Then finally, EPRS 2020, the GDPR can and probably will be read in a way that reconciles both desiderata, safeguarding data subjects, and enabling beneficial AI application. This is a significance of the study. For this study, it will provide useful information for educational reference to provide policy guidelines for the bodies of healthcare organizations. It will benefit to all stakeholders, including AI companies, healthcare organizations, and society. This study will help in Ministry of Health Administration in refining disclosure policies, as well as choosing the appropriate data protection technology solution, and to provide guidelines to Malaysian Communications and Multimedia Commissions in ensuring the processing of personal data in commercial transactions and preventing the misuse of personal data. Conceptual framework proposed for this study, there is 3 independent variable, which is 1 is data protections, 2 data privacy, and 3rd data security, while dependent variable is AI technology adoption. Now we move to last part of these presentations. It's research methodology for this study. To establish position, this study will use positivism and deductive approach. This study has adopted single method and survey for research strategy, while for time horizon, we'll use cross-sectional. For population and sample, the respondent of this study is among hospital employees or AI users from healthcare industry itself. And sample size suggested, according to Critchley and Morgan, 1970, the sample size is 350. This study will use questionnaire, which is Likert scale question, and personal administered questionnaires as a data collection method. For data analysis, this study will use descriptive analysis, person correlations, and multiple regression. So that's all for my research proposal presentation today. Many thanks to those who are involved in this study, especially to my supervisor, Dr. Nurul Fadli. Thank you.